And now, from beyond our dimension, this is the JeffMara podcast. Here's Jeff.
My guest is Dr. Adam Rizvi, critical care physician and neurologist whose work bridges medicine and non-dual wisdom. He has experienced intuitive knowing, visions, synchronicities, and encounters with luminous presences during his patients' transitions. Dr. Rizvi, thanks for joining me and welcome.
Thank you so much for having me, Jeff. You do me an honor by hosting me on this wonderful show.
Well, it's my honor to have you. And let's start with how a man of science and academia wandered into the world of metaphysics.
That's interesting. You know, it's actually the other way around. I felt I had dived pretty deep into spirituality from a very young age. I think that started first for me and wandered into science, begrudgingly, let's put it that way. No, my mother was raised Catholic, and my father was raised Muslim. So early on, I was exposed to multiple religious traditions, and then personally started to dive into the Eastern traditions, Buddhism, Vedanta, non-duality in all of its various forms. And to me, that was the starting world, if you will. But then after college, my dad said, "You can't make money with just philosophy," because I had studied philosophy and comparative religion in college, and strongly recommended that I become a doctor. And I did enjoy science. I was good at it. I loved biology and biochemistry. So I said, okay, well, what the heck? Let's just do it. And I went into medicine knowing I was going into the belly of the beast, so to speak. Even from before med school, I had a sense that there was way more to medicine than the way we do things here. But I did go into medicine wholeheartedly and fully, and in a certain way, I don't want to say it got lost, but I dive deep into the way we approach our patients in medicine. And I think fundamentally that there's a lot of great things in Western medicine, but fundamentally our approach is to fix what is perceived as broken. And that approach is something I started to come out of as I started to practice medicine, as I started to be present at the bedsides of many, many patients who passed on. And I think the big realization was, no, there's nothing broken here. This passing, this transition, death in medicine, in modern medicine, typically is seen as a failure. It means we didn't do enough. We weren't quick enough. We didn't select the right treatment. And so a patient dying often, not always, but often is seen as failure. Failure of the medical system, failure of the physician. But I was seeing more often, I was getting the realization there is no failure here in death. Death is an opening, it's an invitation. It is such a huge opportunity for tremendous spiritual growth. And one of the biggest takeaways is that there is nothing broken. And when you die, it's a transition from one form to another. There is nothing that ends. But I'll leave it at that.
Your work is about non-dual wisdom, but we live in a world of duality, right? So what is non-dual wisdom in this realm?
Well, fundamentally, duality is separation. We feel separate from the world around us. We feel separate from each other. And a lot of the trouble and pain that we experience in the world comes from that perceived separation. The fact that we can hate another human being, that we can feel victimized by another human being, that nations can go to war with each other is predicated on this idea that we are fundamentally separate. And non-dual wisdom, and it doesn't matter what tradition non-duality comes from, there are many traditions that speak about it. non-dual wisdom essentially says that separation that you are perceiving isn't actually there. There's a oneness underlying everything. You think you are separate from another human. You think you're separate from the world around you, but it's not true. It's all one. Now, if you start to see that you and someone that you hate or dislike are facets of the same one thing, it's a lot harder to attack. In fact, it's impossible. It's impossible to hate and attack another when you see that person as yourself on a deep, deep level. Now, it's the trick or the challenge with non-duality is it's very easy to get intellectual and heady. But for me, it all comes down to love. If you really love someone, then you naturally feel a kinship. You naturally feel a oneness with them. And I think that's sort of the gateway. That's the gateway to the perception of oneness is love for me.
How do the teachings of A Course in Miracles and Tibetan Buddhism shape your view of the afterlife?
Both A Course in Miracles, which is my personal spiritual path, and Buddhism, Tibetan Buddhism in particular, acknowledge that life continues beyond the appearance of death. So when the physical body dies, the mind that believes itself to be this self, this sense of self, goes right on. It continues. There's no break. There's no end. There's no oblivion. The Buddhists even have a very well-known, powerful book called the Tibetan Book of the Living and Dying, which outlines all the experiences that one can have moments after the body appears to die. I recognized in that tradition, as well as many other traditions, that this idea of the sense of self continuing beyond death, it's so well explored in these wisdom traditions. But in modern medicine, it's not acknowledged. We are still in a place where, and it's mind-boggling to me, but we're still in a place where it is not agreed upon that we are more than just the physical body. This is the hard problem of consciousness. Does consciousness exist independent of the physical body, or is it an epiphenomenon of neurons firing with each other, which is what a lot of materialist scientists believe? To me, and based on the experiences I've had with my patients and what I've seen firsthand, is that yes, consciousness does in fact exist independent of the physical body. And that's, for me, the ground level. Once you acknowledge that, once you experience that as truth, as reality, then comes the next, which is, now what? What do you do about that? If you do indeed continue beyond death, then how do we best prepare for death? And that to me has been some of the most, probably the most profound question that I ask myself. Every time I see a patient pass away, it brings death back to me. It helps me contemplate my own mortality. And then I ask myself, how can I best prepare for death? And whenever I ask myself that question, it makes everything real in the sense that my petty small worries of the day vanish. And then I come to what really matters. And inevitably it's, do I care for others? Am I being compassionate? Do I spend enough time with my family? Do I speak authentically when something hurts me? Can I tell the person how I really feel? Or am I still hiding my feelings? That's what I mean by real. I guess another word would be authentic. Like thinking about death makes me an authentic human being.
Can you share with us some of your own personal experiences of synchronicities and any other metaphysical things that have happened?
Oh, I'd love to. Yeah. I'll share one story that comes to mind, which is emblematic of many, many cases. It's the story of a patient. We'll call him Robert. He was admitted for COPD, which is chronic obstructive pulmonary disease. And he was on the tail end of that, which means his breathing was getting worse and worse. And he was somewhat estranged from his kids, and the only thing he wanted was to be able to make sure that his son and his kids were taken care of, that they were safe and financially set. And so we were trying our best to get a hold of his kids. By the time we got a hold of his son and told him what was happening so that he could come and fly in, Robert had sort of slipped into a coma where he couldn't respond. His oxygen levels were really, really low. He had a mask on, giving him oxygen. He did not want to be intubated and put on life support, so he was just getting by in terms of his oxygen levels with that mask. And we were telling him, we finally got a hold of your son. Your son's on his way. And his son was flying in and was going to land in that afternoon, the afternoon of the day of his death. And Robert's heart rate was slowing down, and it looked really clear that he was about to leave. And I felt such tension in me, knowing that there was a good chance his son wouldn't see him before he died. And so, feeling that, one things that I do often is I sort of disappear. I go into my office, and I meditate. And so I closed my eyes, I meditated, I thought about Robert, I thought about his son. And what came up for me was a lot of fear came up for me. Like, am I doing a good job as a physician? Should I work harder to keep Robert alive so that his son could see him? And there's a lot of self-doubt, about me as a physician. I looked into that. I let it go. I reminded myself I'm always doing the best that I can. That's all that I can ask of myself. And so there was some self-love there, at letting go of the doubt. And then I gave the whole situation over to a higher presence, a higher power, to source. I just let it all go, and I said, whatever happens is meant to happen. And as soon as I felt the weight of the burden of self-doubt and fear fall away, literally seconds after letting it go and allowing whatever is to be, I get a phone call from the nurse saying that Robert's heart just flatlined. I cannot tell you how many times I have been in meditation in the hospital, working on releasing the situation, giving it over, going to a place of allowing and love for a patient who is dying, only to have a nurse call and say their heart rate stopped, their heart stopped beating. It is uncanny, the timing of it. And so for me, it's one of it's happened over 100 times. With the timing of that, doing that inner work, and then having the patient just let go and move on. It's almost like on some level we're connected, and they feel the letting go when I feel the letting go, and it precipitates that. And so Robert did pass away. I went over to him, held his hand, me and the nurse, and this beautiful, beautiful nurse asked if she could say a prayer, and which, by the way, doesn't happen in the hospital. The hospital setting, it was very strict guidelines in terms of separating religion and faith from science. But in this situation, it seemed perfect. So I said, absolutely, go for it. And she did a beautiful non-sectarian prayer, just really wishing him well. And it was so beautiful to see, because that's all prayer is. All prayer is wishing well for another, wishing well for yourself, wishing well for the world. And that's what she did for Robert. And I felt a huge letting go. Interestingly, and I hope I'm not taking too much time, but interestingly, the moments after Robert passed away, I felt the room actually get a little dark and heavy. And I connected with Robert. I thought about him for a second. And I had this mental image of him sort of confused, looking for something in a dark alley. And I just connected with him on that level. And I said, Robert, you've died. It's okay. Everything is going to be okay. And then almost as if I could hear him, I heard him say, "What about my son? Is he okay?" And I said, "Yeah, your son just landed and he's coming in just shortly. Don't worry. Everything's going to be okay. You can go. You can go. Your son's taken care of. He told us he's fine. Everything's well." And in that moment, I felt a release on his end. And when I opened my eyes, not only did the room feel lighter, it actually felt like the light was turned up, like a dimmer switch had turned all the way up, and I saw this sort of spiraling um, light. If you It sort of looked like a whirlpool above him and to the right, and I just felt like there was movement going in that direction, and then that whirlpool of light just disappeared, and it genuinely felt like Robert was not in the room anymore. It was just a body. It was just a body. So when this is just one of many, many similar stories, I do feel like when the body dies, something does continue on. And I do feel like that presence, that consciousness that continues on can be communicated with. Just like I felt like I was doing on a intuitive level with Robert, I feel like loved ones who've lost someone, the communication doesn't end. It just changes form. We might not be able to talk to our loved one in words like we do now, like you and I are doing now, but the communication can continue, in my opinion.
Have you ever had a patient that was having reactions like a hospice patient? And what I mean by that is like they'll sit up and start talking to somebody that's not there, or express that they're seeing angels or anything like that?
A lot, very often. There's this term, the phenomenon is so well studied, it has its own term. It's called terminal lucidity. And for those who are interested, they could just Google that, look it up. Terminal lucidity. What I've noticed, and the one of the most striking scenarios or cases where I've seen this happen is in patients with very advanced dementia who have been nonverbal, meaning they can't talk because their dementia is so severe. They've been in a hospital bed and they're moments away from dying, or maybe they're days away from dying. They will sit up in bed and start holding totally normal conversations as if they were the way they were years ago without dementia. And sometimes in that lucid state, they'll say, "Oh yeah, I see, I see Anne or Joe. I see my grandpa. I see my mom or dad who've long since passed." And I'll have family members at bedside get very disconcerted. "Oh, they're hallucinating. They're saying that they're seeing so and so." And I have to be careful as a physician. I have to be objective, but I generally say, well, it's maybe they are seeing their loved one, their grandpa. Who knows? Instead of, I think as in medicine, we have a tendency to label this as a hallucination or a delusion. But if they are behaving normally, if they're lucid in every other sense, then why shouldn't they be able to see their loved one?
Do you ever have trouble balancing clinical realism with metaphysical insight?
It's a struggle for me. It really is. Sometimes when a patient of mine is dying, or they're about to die, or a family member is grieving and going through a hard time and wants to know if everything's going to be okay, or what happens in the afterlife, or is there an afterlife? A a big part of me wants to tell them everything that I've experienced, to share all these stories and to share where I'm coming from. But that's not my role. My role is a physician. My role is I do everything I can to support the patient to live a long, healthy life. If I can't do that and it looks like they're going to die, then I do everything in my power to make sure that their passing is comfortable. I will say sometimes family members ask for my personal opinions on things. And then I'll generally say, well, I'll take off my doctor's hat for a second here and step into the role of human to human. And I'll share with you, I've seen miraculous things happen. I've seen amazing things. I've had amazing experiences, and I'll share with them one or two of them. but only if they ask. It's not my role to force feed this or to change someone's mind. It's only if there's an opening on their end.
You wrote a book titled Love Does Not Know Death. How did you come up with that title?
The title goes to the heart of the matter for me, which is that who we really are, in my experience, who we really are is something eternal. Who we really are is something that is untouched by death. The love that we feel from others, being loved and loving, is untouched by death. For me, love is probably the primordial essence, the core essence of reality itself. It's the one thing that you can't touch, taste, see, or smell, but it's the most real thing there is. And so for me, I wanted to highlight that aspect of who we really are is love at its essence, and that is untouched by death. And love does not know death. It goes on and on and on. And in fact, it is outside of space and time. It's eternal in the sense that it is out of time. And so that's the title highlights that for me.
I believe a lot of your work also involves forgiveness. Why is that so important?
What I see at the deathbed, and has been hundreds and hundreds of cases at this point and experiences. I'll give you a small example. There was a case that I remember really well because it caused a lot of drama in the ICU back when I was in Arizona. We had a father who had two daughters. This man was dying, and his two daughters were angry at each other. They hadn't spoken to each other for 20, 30 years. Their father's dying was a chance for them to come together, and they fought it tooth and nail. They would arrange with the nurses and the security guards to find out when the other daughter came so they didn't cross paths, and then coordinate so that they would only go in and alternate and not have to see each other. And working with them to try to find out what would be best for their father. Should we put him on life support? Should we put a feeding tube in his stomach if he no longer could eat? Like these sort of hard conversations, we'd have to have them separately. And if they disagreed with each other, then we'd have to sort of play telephone. And it was so disheartening for me because I saw the opportunity for forgiveness. If those daughters could come together and say, you know what, our dad is dying. Let's just come together and acknowledge the past as the past and move on. And I'll just juxtapose that with another case that I highlighted in the book of two daughters whose father was estranged from them. He lived in China, and their daughters moved to the US to sort of, get away from the family and that whole ordeal. But when their father decided to move from China to the US to be with his daughters and to try to reconnect, they initially didn't want to have anything to do with him. So he was living alone, quietly in Tucson in the hopes that one day his daughters would turn around and try to be close to him. Eventually, it brought him to his deathbed, and he was in our hospital. And we called the two daughters and said, hey, your father is dying. They both rushed in. And the love and respect they showed their father, it's somehow, I don't know what happened, but just knowing that they were not ever going to talk to him again, that he wasn't just off living on his own, he was literally dying. Something about that made them snap and change. And I remember them coming in and just bowing down to their father and honoring him and thanking him for everything. It's as if the entirety of their life of disconnect and ignoring their father, it all dropped away. And I could see it on his face too. just the smile that he gave them spoke volumes. In that one smile, he said, I forgive you for everything. I forgive you for leaving the family. I forgive you for going on your own and not talking to me for decades. And their bow was forgiving him for the perceived injustice of forcing their life onto them and whatever it is that they harbored grievances of. And it took courage. They needed to forgive. And forgiveness for me, and I'll just briefly say, forgiveness isn't, oh, I think you did something wrong, but I'm going to be the better man and let it slide. That's not forgiveness. That's a false sense of charity. That's holding on to, I'm better than you, and so I'm gonna say that I'm forgiving you. No, that I think real forgiveness is going to a place where you acknowledge the hurt that was done, but underneath it all, you see that nothing really wrong happened. Everything happened as it should happen. Everything happened because of someone's upbringing and their childhood and their trauma and their stories. You can see past yourself and past your story to the story of someone else and let it all go and come together in the present moment with love. True forgiveness for me is going to a place where you recognize nothing wrong happened. We're all the same. We're all the same human beings doing the best we can with what we know. And for me, that's why kindness comes naturally. Kindness, being kind to someone, is a natural outpouring of forgiving, because forgiving sees the true innocence in someone else and in yourself.
Have you ever had a patient who had had a near-death experience?
That actually happens quite often. I think because we minimize the stories that patients tell us, we miss out on the near-death experiences that could be glorious stories to tell. Very commonly, a patient will have their heart stop in a procedure, and they will be resuscitated and come back, and I'll see them in the ICU. And one of their first memories will be like, oh, well, I remember when they were resuscitating me. I remember when they brought out the pads to charge me and to shock me. I remember this person commenting on my blood loss. Those comments get brushed away pretty easily. Oh, you must have just overheard, or you must have heard them talking about it while you were waking up from anesthesia. It is far, far more common than we realize. And when I hear them tell me that, I validate them. I say, yeah, you probably did hear that. Your body was dead, but somehow your consciousness, your awareness was still present. You were in the room. You did hear what was happening at that time, and not making them feel like they're crazy, or that they were hallucinating. I think if we embrace this, if we embraced all the anecdotes in medicine, the unusual spontaneous recoveries, the strange events of continuation of consciousness past so-called clinical death, I think we would have enough evidence to, without a doubt, prove the existence of life after death. For me, there's enough evidence already, but I think materialists hold on pretty staunchly to the view that we are just our bodies, and when the body dies, that's it. But my hope is that that will change with time.
Well, how do your colleagues react to your spiritual exploration of death and dying?
It's not something that comes up.
Hmm.
It's not something that comes up. No, I've had a handful of conversations, mostly with nurses who've seen a lot of this at the bedside. I have a handful of doctors that I've spoken to about this. Some find it amusing and interesting, but not relevant to their practice or to their life. Some get into heated discussions. I remember when I was in fellowship, I had a pretty heated set of conversations and debates with one particular colleague of mine who was a staunch materialist. But the nice thing about him is he didn't brush it off as absolute nonsense. He actually wanted to engage in debate. He said, "Well, okay, what evidence do you have? Tell me. Um, uh, what is this just a belief of yours, or have you seen something?" And I would rather have a materialist have an open mind and ask me, what do you base your opinion off of? That would be amazing. I think more now than before, that's starting to be the case. We're starting to have healthier dialogue about what consciousness really is. And I've started to see a lot of scientists come on shows such as yours and other things on YouTube where they are talking about this possibility that maybe consciousness is independent of the physical body.
I don't think science has come up with an actual mechanism of how the brain creates consciousness. Have they?
Well, see, in the question, the question is predicated on the assumption that the brain produces consciousness. And I think that's part of the problem. Science is looking for how does the brain do this? But in my opinion, the brain doesn't do this. Consciousness exists de facto. Another Latin term that I like is a priori, which means it exists before. Consciousness exists before the body and it continues after the body. Now, this is getting a little intellectual, but there's a great philosopher and psychologist. His name is William James at the turn of the century. And he talked a lot about mystical experiences. And he posited that perhaps the brain isn't a creator of consciousness, but rather a facilitator of it. And an analogy would be a radio and radio waves. Radio waves exist. They're always around us, but it takes a radio transmitter, with the dials and the crystals and everything, to actually hone in on a particular frequency and then transduce it, transform it from electromagnetic frequencies to audible sound. I think that's probably what the brain is doing. The brain is taking consciousness and allowing it to funnel in and hone into a very narrow band frequency that we call the material world. And we have a set of experiences of being in a body because of what the brain is doing. But ultimately, my opinion is that the body exists inside the mind, not the mind in the body. And I'm sort of using mind and consciousness interchangeably.
Have you ever considered that the body is a manifestation of consciousness?
Yeah, now we're going into some good waters here. Yeah, well, there's some people that argue that there is no such thing as physicality, that all form, the body, this table, this camera, everything around us is an expression or a manifestation of consciousness. I think that is a very valid perspective on life. Yeah.
Well, if we get back to forgiveness, what is one lesson from your own practice that you have had to forgive yourself for?
My mind immediately goes to a really young gentleman who came in from a drug overdose, and he couldn't breathe. And I remember when he came in, we were rushing to do our best to get a breathing tube in. And I don't know whether it was because he had an allergic reaction to something that he took, but his throat had swollen up so much that we couldn't see his mouth, we couldn't see his airway. And I remember he was lying on the gurney, on the stretcher. I had the breathing tube in my hand and a camera so I could look in. And as I was trying to slide the breathing tube into the tiniest, tiniest of openings because everything was so swollen, at that moment he started vomiting. And then his whole mouth and everything, the entire field that I was trying to operate inside of just filled with vomit. I had to turn him over. We suctioned it out. And as all this was happening, his oxygen levels were dropping. I rushed to get him back on his back and get this tube in. And for the life of me, I couldn't. I just couldn't. I couldn't see anything. I couldn't see the airway opening. And I called for backup. One of my colleagues came over. He tried for, it felt like eternity. Both him and I were having the hardest time. We finally got the breathing tube in after a very, very long time. But as you probably know, when the brain doesn't get oxygen for more than 5 minutes, the brain starts to get damaged. And it had been a lot longer than 5 minutes, we'll put it that way. That the days afterwards, we ended up getting an MRI scan, and his brain was just absolutely destroyed. It was damaged from lack of oxygen. And he ended up not making it. He ended up passing away. And it was, oh man, it took me years to forgive myself for that. I keep reviewing that scene in my head, thinking if I had just been able to get that breathing tube in quicker, if I had just maybe preemptively prepared for him vomiting. I don't know what it would have taken, but I tell you, when I got to the place of forgiving myself, my big takeaway was in every moment, I know I'm doing the best that I can with what I know. And forgiving myself fully for that has enabled me to be so much more compassionate and kind to others who make mistakes, because I know that they're doing the best that they can with what they know. And this is the magic and beauty of forgiveness. Whenever you forgive another person about a particular thing, it allows you to forgive yourself for that very same thing. When you forgive yourself for something, in my case, for failing and making a mistake, I am that much more willing to forgive someone else for making a mistake.
You've probably seen many cases that turned out to be miracles, as well as cases that you and your colleagues just couldn't save. With all that information, do you think that for many people, whether they live or die is predestined?
I don't know. I don't know. The question of predestination is above my pay grade. I will say that the only thing I know is that in every moment, I have a choice. I can choose to see any given situation with love, with a viewpoint of being quick to forgive and slow to anger, or I can see it through the eyes of my ego or that sense of separation you and I talked about, where I'll be quick to anger, quick to judge, and slow to forgive. And every one of us has both of those perspectives within us. We have that voice. And I do know that when we, in my experience, when I forgive a situation, when I can see past seeming injustice to the forgiveness, to the innocence of the person involved, and to my own innocence, again, remembering that we're doing the best we can with what we know, then I save myself potentially years and decades of suffering. Take that case, for example, of my difficulty intubating that young man. Had I not forgiven that, I would have gone into the rest of my career maybe fearing future intubations, maybe fearing future cases of overdose coming into the ICU. I would feel regret come up. Every time someone died because of a difficulty with intubation, I'd berate myself some more because it would just be an echo of that very first time where I failed to forgive. And so what I think happens is maybe our futures, maybe they're written, who knows? But I do feel like the suffering, which is to say internally, the resistance to what is the suffering, that goes away when I forgive, when I'm able to forgive myself and forgive others. So to answer your question, it's possible that our whole lives are scripted and predestined. That's possible. I don't know, but it's possible. But I do know that if we aren't willing to forgive, if we aren't willing to move into that loving place, that gentle, compassionate place within us, then whatever is scripted for us is going to be far more painful without it, without forgiveness work.
Do you think that there needs to be a balance between forgiveness versus being a person that lets everyone walk over them?
That's so good. That's such a good question. Okay. I'm so glad you asked this because, like I mentioned, forgiveness is a shift in perspective. In my opinion, you're going from seeing someone as guilty and worthy of punishment and blame to seeing someone as innocent and worthy of love and kindness. Okay, that's essentially that is my definition of forgiveness, is a shift in perspective. It says nothing about what I do in terms of behavior. I had a colleague who was very he was a surgeon a while back who was exceedingly rude and used profanity and um, was, let's say, very rough to be with. And we had to work together, but it was always his way or the highway. And outwardly, there was a lot of things that he was doing that was wrong, quote unquote, as the world would judge what's right and what's wrong. Um, And my mind often would go to, how could he? This is unacceptable. This kind of behavior is very unprofessional. And in my mind, I was judging him. In my mind, I was attacking him. Um, but all I got out of that was pain and suffering on my end because I was so unhappy. I was so unhappy with, how could he do this? Just the grumbling and the frustration. And I'm sure all of us have someone in our or have someone in our life at work that triggers us in that way, that brings out that sort of anger. Now, after many, many months of working with this, internally, I would just shift myself, shift the perspective, and recognize, you know what? I don't know how he was raised. I don't know what his childhood was like. I don't know whether he was loved as a kid. I don't know whether he's suffered um, uh, pain and been blamed for things, abused in some way. Who knows? Who knows? But I'll tell you, no one behaves the way he did without something hard happening earlier on in life. And that shift in perspective helped me to see him as inherently innocent and, most importantly, worthy of love and worthy of kindness. Not necessarily that I needed to have him walk over me, because what I did outwardly was I had a sit down conversation with him and I told him, listen, I appreciate that you care about your patients very, very much, but we're colleagues and we're teammates. And you cannot use profanity with me or with any of the nurses. Your behavior needs to be professional, and we can't tolerate anything less than that. And I told administration about this behavior, and I said, this is something we need to address. And he was taken aback and said, okay, I understand. It was a short conversation, and he walked away. But I noticed in the subsequent days, he held his tongue. He didn't use profanity as much, and he was a little bit more reserved in how he came across. I still did something outwardly. My behavior still took action. I did not let him walk over me. And I think that's critical. And I'm so grateful you asked that question, because forgiving someone doesn't mean you let them walk over you. You still take action in the way that you are guided to do, guided in and say what you're guided to say. But when I talk about forgiveness, I'm talking about internally, you shift your perspective.
Many guests will come on and talk about love. And I don't think I've ever gotten a really good definition or even asked the question. So, what is your definition?
Love, in my opinion, is knowing that there is only one. Love is seeing unity. And more than seeing or believing, it's knowing. It's knowing unity. Love is what remains when all the attack, all the blame, all the judgment falls away. Love is what remains when the illusion of separation falls away. And so I think love is our true nature in that sense. We operate believing ourselves to be the story of our lives. I might say, oh, my name's Adam, I'm a physician, I'm so and so. But all of that is story. It's just conceptual, it's just thoughts. But what's left without those thoughts? There's this pure awareness. And in this awareness, everything is included. I think the wisdom teachings from all the major traditions at their core speaks to who we really are. And so when we talk about the Oracle at Delphi and other teachings that say, know thyself, this is what I think they're getting at. Know the core of who you are, and that core is love. It's the unity that underlies all things.
Many of my near-death experience guests also talk about that they experience immeasurable love on the other side, and potentially that energy itself is love. Does that make sense to you?
Yeah. I can't speak to energy because I don't know how to define that. But I do agree that when there's this beautiful perspective, I think, which is that if you remove the blocks, if you remove the barriers to the awareness of your own presence, what's left is love. My feeling about it is people who have near-death experiences, the story falls away. The past falls away, the worries, how am I going to make money? What's going to happen in the future? When all of that falls away and you realize that you're still here, what's left is love. I think that love that most NDers experience is present for us right now. We don't need to die. The physical body doesn't need to die for us to experience that. I think we've covered it up with all the worry, with all the fears and the regrets and the sorrow and the shame. It's all covered up. And I think that the journey, the spiritual journey of awakening is really a journey of removing those layers. And then what's left is that indescribable feeling of love and being loved.
What advice do you have for people who are grieving over the loss of their loved ones?
If you're grieving or afraid of death or facing illness, I want you to know this. Nothing of you can ever be lost. Nothing of your loved one can ever be lost. The part of you that loves and is loved, that is untouched by death. The stories that I share in Love Does Not Know Death is my way of sharing that, my way of sharing with those who haven't had these experiences and having them know that love truly doesn't know death. We are connected on such a profound level to each other, not just to our loved ones. Of course, that connection is very deep and profound, but to each and every other human being. And that connection transcends death. What I would say to someone who's grieving, well, first, let me put it this way. What I would say to someone who is facing death or has a loved one who's facing death, do not lose this opportunity. If there's something you want to say, if there's a regret, do not let it go unsaid. Speak your mind, speak your heart, uncover everything, and then let your loved one who is dying share what they need to share with you. If the roles are reversed, just open all doors of communication. Let nothing be unsaid. And in the end, don't shy away from expressing your love. I know men sometimes have a hard time expressing their emotions, but in these moments, don't lose the opportunity to tell your loved one that you love them. You love them very, very much. And for those who have already had someone who's passed on, I want you to know that communication does not stop with death. You can still communicate. You can still connect. You can still tell your loved one that you love them and you care for them and you think about them every single day. And you can still feel loved by them. All you have to do is think about them. Just connect with them at the level of your heart, the level of your mind. Just think about them and you will feel their presence and let yourself be loved by them. That's what I would say.
Have you ever had a shared death experience with a patient?
What do you mean by that?
When the person is leaving their body at the time of death and starting to make their way to another realm, sometimes a person at their bedside or someone close to them will actually have an out-of-body experience and be out of body with them.
Oh, wow. Wow. I haven't, no. I have not. I've witnessed many amazing things at the time of death, tremendous synchronicities. I've seen amazing things. I've seen patients pass away and then watch as lights come out of the body. I have seen, I've had images come into my own mind about the patients, like the case of Robert. I've had intuitions about what the other person who's just died is seeing. I feel like that level of communication is always possible. If you want to tap into or connect with what your loved one is experiencing after death, I think it just takes an open mind and a clear mind. Think about them, hold them in your heart, and you will get images and feelings. You'll get sensations of what they are experiencing on the other side. I think that's very possible.
If people want to find out more about your book, Love Does Not Know Death, should they go to a website?
I have a website called lovedoesnotknowdeath.com. They can check me out there and sign up for my newsletter just to stay up to date. I also have a podcast with a dear friend of mine where we talk about these topics and other spiritual topics, and that is at letterstothesky.com.
After watching this podcast, people may want to reach out to you and ask you questions. Are you open to that? And if so, how do they contact you?
The easiest way is to email me via the contact form at lovedoesnotknowdeath.com. But also, if you want to email me directly, you can do so at dradamrizvi@gmail.com. And Doctor is Dr. Adam, my first name, and Rizvi, my last name, at gmail.com.
Dr. Rizvi, before we finish up, can you leave us with a last positive message?
I would say that every moment is a gift. And every moment is an opportunity to love yourself and to love one another. That's probably the biggest lesson I've learned. Don't wait till someone's about to die or you're about to die to start loving. You can do it right now.
Dr. Rizvi, thank you for your message, and thank you for being my guest.
Thank you, Jeff. It's been a pleasure.
The pleasure was all mine. Thanks for watching the JeffMara podcast. I really appreciate you. Another way to show support is through YouTube memberships. And if you do, there are loyalty badges and other perks depending on your level of membership. All you need to do is click the join button underneath the video to find out more. Thank you for your support.